But today I've been asked to come and highlight another person in North Carolina who has contributed so very much. I have the justification here that they submitted, so I'm going to have to read most of it. Mr. Eddie Jordan, the gentleman that we're honoring, serves as chair for the County Board of Health, and he has so much more to give than just being the Board of Health. You're very active as the compliance officer of Surry County EMS. We've heard that from somebody else earlier. He has leveraged unprecedented advocacy of not just public health, but some of the initiatives that the County Health Department has embarked upon. He has served as a critical component of the county's medication-assisted treatment program that is shared with EMS. He has also fostered the participation of public health in local healthcare peer reviews. Most recently, he has undertaken a role in serving on the Experimental Child Fatality Prevention Team's Data Research Work Group. That's a mouthful. All along the way, not but blurring the lines between public health, healthcare, and healthy people. Now, he has been an advocate for protecting the citizens of the Surry County through active engagement in the passing of several ordinances over his time. And I listened acutely a while ago, and I believe that you have been serving about 8.5 years in some of those roles, but in the other one, more like 40 years. So you have been very instrumental. He has gone above and beyond the baseline requirements to attend just meetings instead of retaining in constant contact with the agency to assist with various projects and processes. The result is a model for our boards of health, this nominator said, where the board functions as a true governing body and is actively engaged in the process and the health department in general. Sir, would you stand here with me? Without his, all of his initiatives, we believe, and the nominator believes, that you have been an absolute honorable person in serving all of these things. So thank you so much. The way it should be.
Thank
Getting
you.
a picture.
Thank you so much.
You got it.
Thank you. And then to find out that I won this prestigious award from this group, from the association, it just made me that much more honored and humble. And I thank you so much. Surry County is a group of people who work together. We're a team, and it's not just me getting this award. It's everybody that's represented here today from Surry County and all the other unsung heroes behind the scenes. But I would like to recognize who's here today and just the support that came with us. Mr. Mark Willis, who's our director of our substance abuse recovery program. Mark Marion, our county commissioner. Sandy Snow, who's our assistant county manager. Eric Southern, who is my boss at EMS, he's our EMS chief, and I'm delighted that he came down and supported me today. And then, of course, Sam is our health director, Austin is our data analyst, and he just does a little bit of everything, I know, for the health department and the board. And then Nathan Walls up here, we have in Surry County, Surry on the Go. It's our county TV program channel, and so they do a tremendous amount of public service announcements and things like that. So we just got a great team in Surry County, and I'm proud to be a part of it. Thank you so much.
I spent some time trying to find out stuff about you. And it took, I kept finding stuff on the internet and finding more stuff and finding more stuff and finding more stuff.
I'm failing.
So then I was like, okay, well, I've got to introduce him. I could talk for an hour. I just cannot believe you're a definitely appropriate person to get this award. Sorry. And of course, it's a spam call.
He's a clerk.
Yeah. My son loves my I started counting the partnership organizations that you've worked with over the years, and I quit, I think at 30. I mean, the fact that there's 21 community leaders on your advisory council, that is phenomenal. But the other thing that I'm so impressed with is the scope of what you've put together. I'm not sure I can pronounce the Surrey County Office of Substance Abuse Recovery. Say that for me. How do you say that abbreviation?
SCOSAR.
SCOSAR, okay, I guess right. But anyway, what's impressive to me is it's from teaching young kids not to do this. It's identifying programs, getting the community involved in educational efforts, to identifying ways to help people, treatment, hospitals, transportation to appointments. I mean, we've talked about that in Guilford, and they may be doing it now, but when I was sort of more involved, when I taught at the university, that was just perceived to be impossible. And then you've got treatment facilities and the recovery, and I don't know if you're the data manager that puts all those numbers for this program on the internet. I'm impressed. I've never seen so many statistics, meaningful statistics, know exactly what's going on. I mean, I was impressed that you knew that during COVID that your numbers rose because you couldn't get the transportation services and everything. But I just want to take one more minute and started out with an employee of 1. He now has 8. You've received a COSAC grant. You've got an intervention team. You've got a community outreach program. The All Stars Prevention Group, I mean, what a good name. Red Ribbon Week, I sort of like that. Vital Links, being a hospital person myself, I thought, what a good name. The Inspire Grant, Learning Academy, I was interested because you actually had some on your internet site of those. And then, of course, your mental health assistance program where you partner with Partners Medical Services, and that gets into the treatment part. And actually, I found a picture of Partners, and I thought it was smart. Not sure who it was, with the governor signing their grant that they got. But also, on their site, there's a picture of the cutest cows I have ever seen. And I think the reason that picture is there is because they partner with the businesses in the county so that the people who go through recovery, they have trouble finding jobs. And so they have people, employers, who will interview them and teach them and give them a job, and that keeps them from relapsing. And so the cows, to me, is the biggest theme of your program, is helping a person. You can always, it's like losing weight. How do I do this sort? You can lose weight, but the problem is, can you keep it off? And so the cows is what that represents. So I just love that little picture. And we have these little one-page things that we put outside. So basically, I want to just make sure I covered everything. You're helping a lot of people in North Carolina, and your team is helping a lot of people. I just hope you're including all the professionals that we heard today from Carl's presentation that have a perspective on the care and in what is needed. But from my perspective, I enjoy reading about what you've done, and praise to Surrey County and praise for them having you. Very, very good. I want to present this award to you. I wish I had a big check that I could present.
And he does too.
Yeah. But anyway, this is the Robert Ed Struther Award. It's a partnership award. So without all the partners that you have worked with, you wouldn't qualify for this, just improving the numbers. But your partners that you've engaged the whole county, I think. And the fact that you included businesses, I mean, I just think that's icing on the cake. I mean, it's phenomenal. It's helping people grow for a better future. So thank you
Thank you.
for everything. Grandkids or kids.
Sure, thank you.
Yeah, and share it with your team.
I will.
Can I get a
Thank
thank you? Real quick. Sure. Okay, thank you. Thank you.
Thank you.
Tell her how many businesses now.
We're at 44.
It is phenomenal. You need to publish your stuff, you know that.
I would give it away.
But you need to publish it.
We'll see.
Or you need to get, what is it? What's your channel?
1300.
Spectrum, to come interview your team. They need to do a,
And we've got Surrey on the go
Surrey on the go.
too. So-
yeah. Yeah, I'd love to see you on 60 Minutes. But anyway, thank you for your work.
Thank you.
And give your data manager a plus.
Hey, just like Eddie Jordan, I am truly humbled by for the recognition. I thank you very much for this. But the truth is, if I speak honestly, what I know about healthcare and health organizations, you could probably put in a teacup and still have room for a cold pitcher of beer. So the truth is, nothing that my team has done would have been possible if it hadn't been for tremendous support is one, but I think one of the things going through the recognition list that Eddie did is that group that they're talking about is a significant group of risk takers. Our our health department director, Samantha Ainge, it was her idea 6 years ago to go to the commissioners and ask for a director's level position to do nothing but address substance use issues in the county. And I did not know how significant that was until I got an intern to help me call 100 counties and find out, I gotta find somebody who I can talk to about this, and we could find no one out of 100 counties other than me that had a director's level position. And that's a big risk. That was a professional risk. Mark Marion, who from our board of commissioners is the most passionate and emotional, supportive person on our board, has been incredible, taking the risk to fund a director's level position. And then, and I say this in public a lot, I asked for direction and they said, we don't understand the problem and we need to know how we got here and find solutions. And they gave me an extremely wide road to stay in, and then they supported me when they continued to do that. Went to Eddie Jordan and our EMS director, Eric Southern. Every goofy thing, every request for support, Eric, he's even doing it now, gives me this little smirky smile, and then he says, yeah, we can do that. We can. And Eddie's support for data, because I said, I don't understand what's going on in this county. His work plotting our overdoses on OD map, his work on going into the intricacies of the data that then we take and tabulate has been, it was really the juice that started the program. And my HR director slash assistant county manager, it was her big risk when I started bringing peer support specialists to hire who have some iffy backgrounds for spending years in substance use, that she took a incredible professional risk in agreeing to hire the people that I have now on staff. So I wouldn't be standing here. I stand on the shoulders of giant risk takers just to accept this. So like Eddie, I accept this on their behalf and on the residents of our county.